Well, hello, and thank you very much for contributing to this series of interviews. If I could ask you, first of all, to tell us who you are and where you work, what sort of work you do.
Okay, my name is Joanna and I'm from the University of Auckland in New Zealand. We have a Department of Geriatric Medicine and I'm an epidemiologist in that department. So I've got interests in chronic care management and care of older people generally. And our unit has had a special interest in long-term care and research around that area for quite a few years now.
Great. And of course, long-term care is understood slightly differently in different places. So perhaps if you, very briefly you could just tell us what it is that you mean when you say long-term care.
Okay, so we focus on work at the moment. Our prime interest is in residential aged care, so people that have moved into institutional care and are being looked after there. We acknowledge that long-term care does include home-based services, but that's not where our focus of interest is.
Great, thank you. Now I wanted to ask you about policy priorities, and in the context of New Zealand, the New Zealand long-term care system, what do you think are the three main policy priorities or challenges at the moment?
Right. So the government in 2010 produced a report, or commissioned a report, which has, because they were concerned about the sustainability and the grey wave of older people coming, the demographic changes and the social changes that were going to drive an increased need for residential aged care or long-term care, institutional care. So they focused on that because the facilities were saying that it was costing them far more than they were actually getting, and they couldn't raise their fees, and this wasn't going to be sustainable for them, and they were going to move out of the market, and clearly that's a concern for the government. So that's the government's concern, is to try to make it sustainable. And part of their response to that is trying to increase home-based care. They have increased that a lot in the last 20 odd years, and it has seen a marked reduction in the proportion of people at any particular age or gender, much reduced utilisation of long-term care in institutions. But that continues to be a concern, and it's something which we haven't solved yet. The other thing which they're trying to do is to standardise the assessments before people go into care, because they are required to have assessments before they go into care. Trying to understand that better, try to use more standardised methods, but I think that they are rolling out the dry NMDs, whatever you want to call it, across the country slowly, but it's hugely resource intensive, and I don't know whether it will actually fly in the long term. Mm-hmm. Time will tell. Mm-hmm.
Any other challenge you want to highlight, or are those the main ones?
Our concern is that we've got poor information. Now the Inter-RI will help get that, assemble that information, but for the meantime decisions are being made that we think aren't as good as they could be. Mm-hmm. But sometimes a policy decision needs to be made without good evidence, and that's one of the things. But we have been trying to do work like trying to reduce hospitalisations from residential aged care and things like that, to try to reduce the burden to the state, because all hospital funds and costs in New Zealand are in the public system, or most of the ones that have come from a residential aged care anyway. So if we can reduce those and manage services in the facilities, that's better, where it can be done safely and well for people.
Mm-hmm. So if you could put yourself in the shoes, well, in fact, if you had the power of government, and you could introduce one policy change in the long-term care system in New Zealand, which one would you select?
I think none of the ones that I've talked about, but something which will try to support the people trying to provide care in the facilities by having a better linkage between the acute hospitals and the facilities, so that the geriatricians or gerontology nurse specialists can reach into the facilities, and that there's a better liaison and support system for the nurses and caregivers in the facilities. I think
facilities, really is that what we would call in England residential care, and is that what you mean by facilities?
Residential care to me is what I started off by talking about, institutional long-term care. So that's facilities that are providing hospital level care long term, so requiring nurses around the clock, and also people who require daily care for ADL, IADL needs, for personal care in an institutional setting. So they need supervision every day and it can no longer be provided at home. So both of those together we lump into a thing that we call residential aged care, and we talk about facilities providing those sorts of care levels. But there'll be specialist facilities in there. Some are psychogeriatric, some are dementia care. Many of them, most of them perhaps, are what we call rest homes, where it's not needing a nurse around the clock. And then there are what you might call, well, those would be what you call care homes, and then what you call nursing homes we'd call private hospitals. But they're chronic care facilities.
Great, thank you.
Terminology is an awful thing,
absolutely,
isn't it?
Absolutely, and they lead to so many misunderstandings.
Yes.
So I think you've already touched on this, because you were talking about the collection of information as you know, a very important challenge. So in terms of research priorities, would that be what you would see as the main research priority, or are there others that you think, you know, are really pieces of evidence that are required in order to meet the challenges of the long-term care system in New Zealand?
So different researchers will be doing different things. My focus is on trying to inform policy at a population level. So I'm trying to make sure that the data or the information that our policymakers have is based on sound information at a policy level. And in recent times we found some quite glaring gaps in information, and then we've also found such wide, diverse, even just counting the number of people in residential aged care, the reports vary from something like 3% to something like 9% of the over 65s, and clearly this is wrong and we need to fix that sort of information. So information care at a population level is what I'm thinking firstly about, what our current levels are. We've got reasonable information about trends, but current levels is a trick. Yes, and turnover, how many new people do facilities have to cope? Length of stay information we don't have, and we suspect that it's shortening, and that adds largely to the burden of the people that are providing the care in these facilities. And if you've got lots of short-term stayers, that's a big burden to get up and running and to get to understand this client's needs and things.
So now I would like to finish by asking you a round of 5 quick-fire questions. and here the idea is that you would rate on a scale from 1 to 10 the performance of the long-term care system in New Zealand. Starting first of all in terms of, you know, as a policy priority, what sort of rating would you give?
It's a policy priority, right. So I'm not trying to compare it to other countries. I immediately...
No, yes, it's how you feel.
Think about a reference group. Okay, so I'm not thinking about that. I'm thinking about where it is in the scheme of things.
Exactly.
Probably a 3 out of 10.
3 out of 10. Thank you. And in terms of people's, the general population awareness of how the system works and what the system could offer them if they were to need long-term care?
I think that would vary enormously by how old you are. I suspect that a 20-year-old would have not many notions at all, but a 60-year-old or an 80-year-old, even if they weren't in a facility, may have an understanding, perhaps 6 out of 10. This is not a quick fire answer, but never mind.
No, that's absolutely fine. It's absolutely fine to compliment the number. And so if you now were to rate the job that the system is doing in terms of meeting the needs of people with the long-term care needs.
I think that the people that are living in long-term care facilities probably have most of their needs met. So let me think, probably, well, maybe only a 7, not any more than that. They don't get dental care met in New Zealand. They don't have much attention to nutrition. I mean, they'll have the food provided, but if they don't care to eat it, then maybe they don't get to eat it. Yes, so I think yes, there are probably still problems. Now, if you're not in a long-term care facility and you're receiving care at home, probably less service. I'd maybe go to 6 out of 10.
And what about informal carers?
Oh, they get very little support. families and friends and neighbours get almost nothing, yes. And nor are they included in the surveys, which is trying to assess the burden on those carers. There is no carer type survey. And although at one stage I was involved in trying to get a whole lot of government departments together that might be interested in that, and they all said they'd be interested in, but then the main department that would have had to address the unmet needs that that survey would have uncovered pulled out, so it wasn't done.
For shame. And the final rating is, you know, the different services that need to be coordinated, you know, to provide good care to people with long-term care needs. How well are they coordinated? No.
It's certainly better than it used to be. There used to be quite a bit of cost shifting because the funding came through different channels, but the district health boards now manage the funding for all the people in their population, and so there's now an incentive to try to improve somebody's rehabilitation rather than shutting them off home, because if those services, they end up by requiring more services later. So somewhat better than it used to be, but our score out of 0 to 10, 1 to 10, 6, 7.
That's great. Well, thank you very much.
Thank you.